Hi everyone, my name is Vivian Nguyen. I'm a candidate of pharmacy class of 2021, and today I will be going over the medication Liraglutide, commonly known as Victoza. First, I'll be going over patient counseling points. Victoza is a once daily, non-insulin subcutaneous injection in patients with type 2 diabetes, along with diet and exercise that is proven to lower A1C and blood sugar. It can be used at any time of the day, with or without food. Victoza is injected under the skin of your stomach, thigh, or upper arm. Change your injection site with each injection and do not use the same site for each injection. We will be now going into detail on how to use your Victoza pen. Take your new Victoza pen out of the refrigerator. Wash your hands with soap and water before use. Check pen label before each use to make sure it is your Victoza pen. Pull off the pen cap as seen in Figure A. Check Victoza in the cartridge. The liquid should be clear, colorless, and free of particles. If not, do not use. Wipe the rubber stopper with an alcohol swab. Remove protective tab from outer needle cap, as seen in Figure B. Push outer needle cap containing the needle straight onto the pen, then screw needle on until it is secure. Pull off outer needle cap, as seen in Figure C, and do not throw it away. Pull off inner needle cap and throw away, as seen in Figure D. A small drop of liquid may appear. This is normal. If it is a new pen, turn dose selector until flow check symbol has a 2 dashed lines with the pointer, as seen in Figure E. Hold the pen with the needle pointing straight up. Gently tap on the side of the pen to get rid of any air bubbles, as seen in Figure F. Push the injection button until you see 0 milligrams in the dose window. You should see a drop of liquid at the end of the needle. This means that your pen is ready to use, as seen in Figure G. For routine use, turn the knob away from you until you see the number for your dose in the window. Press down on the center of the dose button to inject until 0 milligram lines up with the pointer, as seen in Figure M. Keep the dose button pressed down and make sure that you keep the needle under the skin for a full count of 6 seconds to make sure that you receive the full dose. Keep your thumb on the injection button until you remove the needle from your skin, as seen in Figure N. You may see a drop of Victoza at the needle tip. This is normal and does not affect the dose you just received. If blood appears after you take the needle out of your skin, apply light pressure but do not rub the area, as seen in Figure O. Carefully put the outer needle cap over the needle, as seen in Figure P. Unscrew the needle. Do not share a Victoza pen with other people, even the needle has been changed. You may give other people a serious infection or get a serious infection from them. Use a Victoza pen for only 30 days. Throw away any used Victoza pen after 30 days, even if some medicine is left in the pen. Keep pens and needles out of reach of children and pets. Keep refrigerated until you're ready to use the pen. The most common side effects include nausea, vomiting, diarrhea, and headaches. These symptoms decreases over time. Talk to your healthcare provider if these side effects bother you or do not go away. Victoza may cause serious side effects. Stop using and call your healthcare provider right away if you have inflammation of your pancreas. Symptoms of pancreatitis are severe pain in your stomach that will not go away with or without vomiting. You may feel the pain from your abdomen to your back. It can cause low blood sugar, known as hypoglycemia. Your risk for getting low blood sugar may be higher if you use Victoza with another medication that can cause low blood sugar, such as sulfonylurea or insulin. In children who are 10 years of age and older, the risk of low blood sugar may be higher with Victoza, regardless of use with another medication that can also lower blood sugar. It can cause kidney problems, known as kidney failure. In people who have kidney problems, diarrhea, nausea, and vomiting may cause loss of fluids, also known as dehydration, which may cause kidney problems to get worse. Gallbladder problems. Symptoms of gallbladder problems includes pain in the right or middle upper stomach area, nausea and vomiting, fever, and your skin or the white part of your eyes to turn yellow. Now we'll be going into detail about Victoza. Here's a formal introduction to Victoza. It belongs to the drug class called glucagon-like peptide 1, GLP-1 receptor agonist. It was approved in the US in 2010. The pros of Victoza are that it decreases A1C from 0.5 to 1%. It reduces the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes and known heart disease. It has renal benefits and weight loss. The cons of Victoza are that it requires injection. There are adverse effects such as increased risk of medullary thyroid cancer and pancreatitis. It's very expensive compared to the other medications for type 2 diabetes. Our next important element is the mechanism of action for Victoza. Victoza works in three ways like the hormone GLP-1 to help control blood sugar. First, Victoza slows food leaving your stomach. GLP-1 is normally released from your small intestine when you eat. This slows down the process of food leaving your stomach, which helps control your blood sugar after meals. Second, Victoza helps prevent your liver from making too much sugar. Lastly, Victoza helps the pancreas produce more insulin when your blood sugar levels are too high. Victoza does this by helping important cells work the way they should. These cells are called beta cells, and they help control blood sugar by making and releasing insulin. Doses and formulation of Victoza. Victoza is available in pre-filled multi-dose pen that contains 18 milligrams per 3 ml. Victoza is clear and colorless solution. The pen delivers doses of 0.6 milligrams, 1.2 milligrams, or 1.8 milligrams. The initial recommended dose for Victoza is 0.6 milligrams daily for 1 week, then increase to 1.2 milligrams daily. As for dose titration, if additional glycemic control is required, increase the dose to 1.8 milligrams daily after 1 week of treatment with the 1.2 milligram daily dose. We just talked about the dosing, but let's take a deeper look with dose adjustment. For hepatic impairment, no hepatic dose adjustment is necessary. For renal impairment, no dosage adjustment necessary. Use with caution when initiating therapy and with dose escalation. There is limited data in patients with end-stage renal disease. Adverse effects of Victoza includes nausea, vomiting, diarrhea, constipation, hypoglycemia, weight loss, injection site reaction. Some warning and precautions to be aware of while on Victoza is that this medication does contain a black box warning. The black box warning is that there is an increased risk of thyroid C cell tumor. Patients should be referred to an endocrinologist for further evaluation if serum calcitonin is measured and found to be elevated or thyroid nodules are noted on a physical examination or neck imaging. It can also cause pancreatitis, which can be fatal, usually in patients with risk factors such as history of pancreatitis, gallstones, alcoholism, or increased triglycerides. Hypoglycemia, hypersensitivity, renal impairment, and acute gallbladder disease can also occur. You should never share Victoza pen between patients, even if the needle is changed. Pen sharing poses a risk for transmission of blood-borne pathogens. Monitoring parameters to be aware of for efficacy is A1C at least twice yearly in patients who have a stable glycemic control and are meeting treatment goals. Quarterly in patients not meeting treatment goals or with therapy change. Also monitor blood glucose. As for safety, monitor renal function, signs and symptoms of pancreatitis, signs and symptoms of gallbladder disease, signs and symptoms of hypoglycemia, signs and symptoms of hypersensitivity, and calcitonin levels for medullary thyroid cancer. These are my references. Thank you everyone for listening to my presentation. Have a great day.